Welcome to everyone who's joined us today. My name is Laura Hafley. I'm a reporter with CBS News Boston, more lovingly known in the area as WBZ. I'll be your moderator today as we discuss the boom of online gambling and its effects on public health. I'm so excited to introduce a group of our brilliant panelists who I will ask to raise their hand as they're introduced so our audience can put a face to the name. Director of the Office of Problem Gambling Services for the Commonwealth of Massachusetts, Victor Ortiz. Adjunct Professor of Global Mental Health at the Harvard T.H. Chan School of Public Health, Shekhar Saxena. Professor and Director of the Rutgers Center for Gambling Studies, Leah Nauer, is over the phone with us right now. Hi, Leah.
Hi.
And co-director of the UCLA Problem Gambling Studies Program, Dr. Timothy Fong. We've witnessed gambling evolve over the years, from in-person gambling like casinos, slot machines, horse racing, to now having access to gambling right on our phones and in our pockets. Here in Massachusetts, online sports betting was only recently legalized in 2022. Mr. Fong, Timothy, for people unfamiliar with gambling, can you define it and the forms that it's taken?
Absolutely. And thanks for having us on this amazing panel here today. Gambling has been part of human behavior for hundreds of thousands of years. Very simply, gambling is putting something of value, usually money or time, on an event of uncertain outcome in order to win a larger reward. Now, as you just said, this phone is with me 24/7. 15 years ago, we had to drive an hour, 2 hours to a casino. Now, the casino comes to us. And the various forms of gambling that are available are growing every single day. It isn't just simply betting on sports on your phone. It can be things like betting on stocks, financial trading, prediction markets, betting on the election. We have social casino games where you don't even win any money, but you spend a lot of time and you spend real money playing the game. We have video games that have gambling inside of the video game. So nearly every single week, we see new forms of expansion of gambling activity on not only our phones, but in our real lives, to the point where gambling is not only endemic, but it's so much part of our daily lives that it has changed the fabric of what we do to our body, our brains, and our minds.
Shekhar, this question is for you. Is this more recent development of online gambling more harmful than gambling's more original forms?
Thanks, Laura, for having me in this panel. The short answer is yes. But let me just go back to say, how does online gambling and gaming work? It's a confluence of three kinds of industries. One is the gambling industry, second is the technology industry, and third is the financial industry. And when they come together and give you an online place to put your money on, the impact is really massive. As Timothy said, we all have a casino that we walk around with. And the technological companies make sure that the experience that people have is seamless. The gambling companies make sure that you have a tantalizing reward at the end of the game. And the financial companies make sure that you can put in money very easily. All your money can go into online gambling with just a click or a tap. And that's what makes it more dangerous. So, yes, it is definitely much more harmful than the usual other kinds of traditional gamblings that people indulge in. It is continuous, it is intense, and it can be financially and also physically and mentally extremely harmful. In fact, I was part of the Lancet Commission, Lancet Public Health Commission on gambling, and the data reveals that online gambling can be 10 times more harmful than the other forms of gambling. Back to you, Laura.
Leah, let me ask you, is there an age group or a demographic that may be more at risk of those targeted promotions and ads that come through online gambling? And I want you to, if you can, get into sort of this social media aspect of it as well.
Sure. I think the group that's the most at risk right now are the emerging adults and adolescents. We have a study that's going to go into the field looking more in depth at this year and tying it to how involved the state they live in is. So we'll know a little bit more about the context. But what I can say is there's a whole kind of cottage industry that has sprung up around sports wagering in the form of social sports wagering apps. And these apps obviate getting in trouble legally because they are built on a sweepstakes model. But the long and short of it is what they do is they prime young people who are underage to sports wager, and then that then will triage them into sports wagering for money. And what we know is the longer someone plays and the more intensely they play over time, the higher the rates of problem gambling. So we are starting people much younger. So we're anticipating there's going to be more problems.
I want to circle back to that question shortly, but Mr. Ortiz, we'll go over to you. You're the director of problem gambling services in Massachusetts. Have you noticed evolving risk factors, certainly since the implementation of online sports betting in the state, which, as I mentioned, started just back in 2022?
Yeah, we thank you so much for having us and appreciate the invitation to be on this great panel and having this discussion. We definitely have noticed a significant change. First and foremost, in regards to youth, we have long understood for the last 10 years or so that an estimated 46% of both middle school and high school students have gambled within the last year. And that's been very consistent over 10 years, even before sports betting. And with the largest sports betting in Massachusetts, we have gotten many calls from parents and family members concerned about the advertisement and the intensity of the advertisement and impact in regards to the exposure to young people. And specifically around risk factors, we've long understood through research that the two major risk factors that transition people from social stages of gambling to problematic stages of gambling is low education attainment and low economic status. And that's been consistent regardless of what type of gambling we're discussing. But with the emergence of sports betting, those risk factors are shifting. And what we're seeing through research is that individuals with higher economic status and higher education are also at risk. And we're starting to see that not just in in the research, but we're seeing it played out through our helpline. We're getting more and more calls from individuals who are experiencing significant distress who are not our typical callers, right? And so this is concerning, and something that obviously is something that we need to continue to monitor over time, but it's definitely something of concern.
According to the National Council on Problem Gambling, roughly 2 million people struggle with a gambling addiction. That number grows to 6 million when you're talking about people who struggle with a moderate gambling addiction. When it comes to drug addiction, alcohol addiction, and gambling, at what point does it become an issue? How thin is that line between fun and a problem? Timothy?
So that's a great question. So number one, you zoom back out. So that means that the vast majority of people who do gamble do so in a way that does not generate long-lasting harm. It's recreational, it's fun, it's part of their entertainment budget, it's part of their lifestyle. Then there's another segment where their involvement deepens to the part where it creates a little bit of damage. Maybe they're lying to somebody, maybe they're spending too much, maybe they can't work so well the next day, much like folks with early alcohol use disorder. That's what early problem gambling looks like. Gambling addiction, otherwise known as gambling disorder, is categorized as an addictive disorder. It has the same biological, psychological risk factors as other addictive disorders. We have brain imaging, we have neuroscience to show that it essentially is a condition characterized by the forces of addiction. So what does that mean? It's a disease that we can't detect by urine drug tests, but we can measure it by behavioral measures. And very simply, it's this. It's when ongoing continued engagement in gambling activities despite harmful consequences. So when people say, well, what does that mean? It means that roughly about 1% of Americans are walking around right now suffering from the consequences of gambling disorder. This is not a disease of willpower. It's not a disease of morality. It's not a condition that people want to fall into. It's a condition of deep shame and really harmful consequences to the body, the brain, the mind, and the spirit. And that's how we kind of reframe these sorts of things. But very simply, again, gambling disorder is an addictive disorder. Gambling disorder is a mental health condition. And oftentimes, because it overlaps so much with other mental health conditions, this is how we're educating and getting the public to understand why it is a public health issue to identify it.
Leah, I want to switch over to you and stay on that topic for a second. Just to elaborate more, Timothy, on what you said, there are addictions that are a little bit more visible. That includes drug addiction, alcohol addiction. There are programs widely known that help with those kinds of things, Alcoholics Anonymous being one of them. Talk about why gambling addiction is a little bit more invisible. As Timothy mentioned, you could see someone walking down the street and not know how deep rooted that issue is. Can you talk about how that contributes to online gambling being a public health issue?
Sure. Gambling disorder is very complex because in addition to what happens with the brain, there's the psychosocial aspects. The range of harm is broad as well. And so if you look at, so for example, in our studies, people that are more likely to gamble online only have the highest rates of problems, followed by, mixed venues have the highest rates, followed by online only, and the land-based have the least amount of problems. So people that were gambling in land-based venues had to take time off work, or their families knew. Now, the ones with the highest rates are lying in bed at night on their iPad while their partner's asleep. And so it's very easy to hide it. It is 24 hours a day. It's very easy to go among sites. And what we see is the higher the rates of problems, the more sites that you're using. And we also see that we have had a much higher proportion of people who are moving, who are transitioning from lower levels of risk to higher levels of risk. And that's where a lot of this sort of hidden addiction piece comes in, and it's amplified or exacerbated by the use of alcohol and sort of other addictive behaviors and mental health conditions, particularly anxiety, depression, high rates of suicidality, and all of these things sort of fuel this progression.
I believe that was actually one of our viewer questions as well, is what does online gambling couple with in terms of addiction? And as you mentioned, it can come with all kinds of things. Being in a casino, you have alcohol at your beck and call. So that's a really important point to make as well. So thank you for that. We know what the problems are. And we'll continue to talk about them, but I want to slowly start transitioning into the solutions. Like I mentioned, there are programs out there for addiction. Some of the more widely known programs are more successful for the male population than for the female population. Timothy, once a person reaches out for help with online gambling, what's the best strategy for treatment? How well do they work? How can someone move forward?
So I'm a addiction psychiatrist. So I approach this from a psychiatric standpoint. We know that there are biological, psychological, and social risk factors that lead to this condition of gambling disorder. That means there are biological, psychological, and social treatments that help alleviate and get people into successful recovery. So for instance, if you were to make an appointment and to sit with me, then we would go through certain medications that we can use to address the co-occurring mental health conditions, or certain medications to reduce the urges and cravings for gambling behaviors. Psychotherapy is the mainstay in focusing on reasons of gambling and developing other ways to control and manage the gambling urges and other things like that. Social treatments, restoring connection and community, and Gamblers Anonymous, and finding purpose. I think of it very simply in our treatment. We want folks to look to improving their lives in home, health, physical health, mental health, purpose, and community. These are the domains of recovery we want. The good news and the phenomenal news is that even without an FDA-approved medication, when people come into treatment, and it doesn't matter what state in America, it doesn't matter what type of psychotherapy, it doesn't matter in some ways the experiences of the therapist, people do well when they stay in treatment. The longer you stay in professional treatment, the better you do. Our state of California has a state-funded treatment program, and we've been doing this for 14 years. Every year, the data looks good, where we know the more sessions people have, the more connections they have, the better they do. And that's a myth that, quote, gamblers don't get as better. That no, we know, just like any other addictive disorder, when you come into treatment, when you get professionals doing it, you're going to do a lot better. Another quick example, another biological treatment people forget is sleep or eating right, physical exercise. These are biological treatments for addiction. These are some of the things that we're going to focus on in professional treatment.
Shekhar, talk about addiction and that it can be hereditary, and in most cases, people who do have addiction in their families, talk about what they need to be paying attention to when it comes to online gambling, and again, that thin line between fun and a problem.
Laura, I just want to, for a moment, go back to the fact that it's not only the people who have dependence or a disorder who suffer harms. As Timothy explained earlier, there are a lot of people who suffer harm just because they are gambling and not because they have a disorder. In fact, to quote the figures, the prevalence of gambling disorders is between 1 to 5%. Usually people say between 1 and 1.5% globally, which means that it's about 80 million people in the world who might have this, but the people who suffer harm are much more. It's about 10 to 12% of people who gamble who suffer some kind of harm. It can be physical, it can be mental, and definitely economical. So we are talking about a very large number of people, estimated about 450 million globally, who suffer harm. Now, the solutions, as Timothy explained, are in a multiple way. It's psychological, it's social, and it can also be economical, because many of these people have suffered irreparable damage to their incomes, they are under debt, and all of those things. So the usual practice of providing support to people who have some kind of dependence, whether because of alcohol, drugs, or because of online gambling, do play a big role in doing that. What I do want to also talk about is the policy environment, because yes, we need to help the people who have been harmed because of that. But are there policies that we need to institute which actually decrease the public health impact and the harm of these phenomena? And there is scope for local, regional, national, as well as international policies, which can do a lot of help in decreasing the harm that people suffer. On a general basis, more the use, more the harms are, and that applies equally to alcohol as to online gambling. So there are people who are more vulnerable, but overall, if the volume is more, the harms will be more. And that's what needs to be kept in mind as we frame policies.
Victor, I want to zoom in on Massachusetts for a second. The Northeast in general is much more unfamiliar with gambling than places like California and Nevada. Of course, it's not unprecedented. We've had places like Atlantic City for a long time now. But overall, it's a really new concept in comparison. How much responsibility does Massachusetts need to be taking for providing services for people who are now able to regularly access, obviously casinos, but also online gambling?
Thank you for the question. In Massachusetts, we were one of the last states to actually get a physical casino in our state. And because of that, there was many lessons learned from prior sort of policies that were passed in other jurisdictions. And because of that, and thanks to our legislators in Massachusetts, who were very forward thinking, wanted to make sure that there was significant resources allocated for mitigation purposes. And so Massachusetts has an unprecedented resource that is allocated for both research, for prevention, for programming, treatment as well, unlike any other state. And so because of that, it gave us an opportunity that other states might not have, might aspire to, but might not have. And it gave us an opportunity to really reimagine our approach to mitigation. And that is by taking a public health approach to this issue and really putting that into action. And so our office over the last 9 years has been diligently working to really build a comprehensive public health model for the mitigation of problem gambling. But let's be clear that the reason why we're in this position is because the resources have been allocated thanks to legislators for this to happen, and it gives us the opportunities to do the work that's necessary that everyone here has raised.
You've been an advocate of federal regulations and oversight. We have a viewer question. I was going to wait until the end, but I think it's appropriate for right now. This question is from Isaac. I apologize, I don't have your last name. Isaac asked, do you think framing of problem versus responsible gamblers is counterproductive by focusing on individuals as opposed to gambling companies and the products they offer? So again, tie this into the idea of federal oversight and how that might help.
Is that a question for me? I'm sorry.
That's for Leah. I'm sorry.
Leah, okay.
Oh, great. That's one of my favorite questions, Laura. So I am a big advocate of like the UK Gambling Commission. I think that the states right now, it's the wild, wild west with regulation. You have states like New Jersey that have a lot of regulation, and you have other states that I won't name that basically have nothing. And I think we need a federal presence, a regulatory agency like we do for cigarettes, for alcohol, for other forms of addiction. I also will note that the figures that Shekhar gave globally, and that when we drill down to states like New Jersey that are saturated with gambling, those rates are much higher. So high risk gambling is at about 6%. Our last prevalence survey, we had 19% of the people with some problems. So we need to have an opt-out versus an opt-in system. We need, in other words, when you go to sign up for an account, there should be your ability to set limits on your time, on how much you deposit, on how much you lose. And you have to opt out of those, or else there'll be some basic limits placed on you. And I'm a big proponent of affordability guidelines, which puts the onus on the gambling companies to assure us that this person is not spending more than they can afford. And all of these things would have to be prescribed federally.
I think that's a really interesting point. I want to stick with the responsibility of the casinos and the companies themselves. We're living in this unprecedented time where almost everything we talk about is tied to social media, is tied to technology, and again, our phones being right in our pocket and often in our hands at all times. When you talk about gambling and the access to it, right? So whether you're a younger person or maybe you're in a state that doesn't allow certain types of gambling, it's not impossible to do it anyway. What is it going to take to fix that problem? How much support do you need from lawmakers? And frankly, is it even possible? Timothy, I see you nodding your head, so I'm going to start with you.
Look, everything's possible. We went to the moon. We're going to go to Mars, so we can do anything we want. It's just, where's that willpower? And you zoom all the way back. Why is gambling even regulated? Because there's risk, because there's harm, because you need to have a product that is safe. That's going from there. If there were a maximum cap on how much you could spend, there would be, way differences. But it has to be regulated, just like food safety, air quality, water quality, because it is an issue of public health, because it impacts individuals, financial, family functioning, the whole thing. So we know that for sure. Number two, we know that, again, the regulation of it is a new area of government. This is science-based legislation that we're only getting into over the last 40 years. And so many times the technology is moving exponentially way faster than the governments can respond to or that the public can respond to. Again, the phone is only what, 12 years old. And we're talking about in just 15 years, we've gone from not being able to place a single bet online to have an infinite amount of gaming and gambling opportunities on my phone, and combined with adding all that money and ability. So we're talking about technology that has rapidly gone so fast. And traditionally, again, gambling has not drawn the attention of the feds because it's always been a state issue. And again, many things have to be corrected before we do that. Again, I have to highlight this again. This is online gambling we're talking about here. We're not talking about brick and mortar or going down to the gas station and buying a lottery ticket. We're talking about online gambling that has so many deep ramifications because the technology has changed so quickly. So again, right now, again, as a quick example, advertising is not regulated well. Casinos that operate without being regulated are not shut down. Online credit companies that make access to credit, online credit, super easy, that allows you to gambling, that's not considered part of it. And again, just here in California, we have many kinds of unregulated gambling operators that we don't even know where they're operating from, that technically are operating outside the letter of the law. Who has the power to actually enforce and shut them down? You shut them down now, I could open up a gambling website in 2 hours if I had a computer science major with me. But that's how easy it is to create these opportunities. So again, lots of fascinating areas for us to work on and tackle.
I was going to ask about that, the amount of apps there are out there, and there's not a lot of oversight on the App Store as to what can go up there, whether it's in a beta phase or completely ready to go. It's tough to regulate that. And as we know, Gen Z especially, they really know how to access what they want to get their hands on. They've grown up in this age and they know that they can reach anything they want to with the snap of a finger, which is making things like this easier to access and potentially more harmful. Shekhar, I want to switch over to you. Being at Harvard, and this is a bit of a more anecdotal question, but have you noticed over the years a bigger interest in the effects of online gambling, whether it's in classrooms or among the student population? And is that interest people who want to be doing it or people who are concerned about its growth?
Both, actually. So yes, we have noticed even amongst our students much more interest in at least experimenting with the online gambling. And certainly we have noticed that parents are becoming extremely concerned about the gambling behavior of their young people, even school students, but certainly when they are adolescents, they are experimenting and many times indulging in more severe forms of online gambling. Also, there is much more interest in research, in surveys, in the kind of interventions that can help. But I would like to point out the public health aspects, which is again attracting a lot of attention. And I want to respond to the question that Isaac threw at us. Responsible gambling is something that the companies love to talk about because it puts the responsibility on an individual. The public health framing is talking about the environment in which people live and the kind of promotion, the kind of incentives that are there. And we certainly favor a much more public health approach and not the responsible gambling, putting the responsibility on the individual. Yes, people have some responsibility, but it's the environment, it's the technological environment, the social environment, and the economic environment in which people live. And that's exactly why regulations are so very important. One area which is prime, ready for more research is the impact of policies. And in fact, even within USA, we have many states with very different levels and very different kinds of policies. And I think it will be a very good study to see whether longitudinally the liberalization of gambling or tightening of gambling laws have an impact on the numbers of people gambling, but also the harms that people are suffering because of that. Over to you, Lara.
Victor, is responsible gambling possible?
Well, I know that that's debated in many circles, and I think that my focus and our focus is really to promote the public health approach and the difference. I think that that's where I put all my energy and time into. You know, it is the predominant ideology in our field. It is what is probably 90% or not even more of the efforts in our field. And I have been been sort of advocating that we shift our attention to a broader public health approach to this topic. And I think that slowly but surely people will get there. I think we will, because I think as more that the conversations happen and look at the data and look at the impacts, the more that we are sort of leaning to saying, you know what, a public health approach to this issue is what we need. But it requires resources, right? It requires investments to do public health work and to do it well because of the comprehensive nature of public health. And we're fortunate in Massachusetts that we can do that, that we can be able to do that. And let me point to some of those things that I think matter that differentiates from sort of the responsible gambling sort of ideology. One, we know that public health approach is a population-based approach versus individual sort of approaches, and the data shows that it's more effective because we're taking a population and it's comprehensive. We know that people that are experiencing a problem with gambling have high rates of comorbidities with mental health and substance use disorders. So it gives us an opportunity to think about comprehensive approaches. But the other thing that's important in public health is epidemiology. It's understanding who's being impacted, how they're being impacted, and where they're being impacted, right? And so there is no surveillance system in the country, none whatsoever, of problem gambling, none whatsoever. There's no system of public health surveillance. We are establishing that in Massachusetts for the first time ever, right? We need to understand in real time who's being impacted and how they're being impacted so that we can be able to mitigate those harms. Lastly, I would say this. You raised a question earlier about gambling and its impacts. And oftentimes we default the thinking to only gambling, and rightfully so. But when we put a public health lens, what we understand that even individuals that are recreational gamblers, we have studies that have shown that over 40% of people that are recreational gamblers, these are the people that are safe, right? That are gambling socially. But when you put a public health lens, what you see is the following. You see those individuals have higher rates of obesity, consuming alcohol at higher rates, and using prescription drugs at a higher rate. That's why public health matters. And so I think that the minute that we shift our attention to a public health model is when we can start to have a conversation about mitigation. And I am encouraging our entire field to make that shift quickly and swiftly.
I want to go back to Gen Z and put a little bit more of a focus on online gambling because that is what we're talking about here. Sports betting online on your phone. Gen Z has a lot of access to this, and a lot of the ads are targeting that demographic. What can lawmakers, what can governments, what can local organizations do to offset some of those ads that are very clearly targeting young people? Is it promoting ads themselves? Leah, can you talk about that?
Sure. I mean, I think that they are targeting young people, but the ultimate goal, if you see in states like New Jersey where they were blanketed with ads, now you'll see ads where they're triaging young people to the online casinos. That's where they make their money, and that's where they want them to go. They don't make their money with sports wagering. So I think that there's a two-prong approach. First, we need sort of oversight on the macro level. And then we also need more awareness on, in schools, because this is being promoted. We have a faculty member who just did something on athletes and coaches. And the coaches have very high rates of gambling problems, and these are the influences on the kids. So on one hand, we have gambling being sort of a stigmatized word. If you ask people if they gamble, they'll say no. If you remove the word gambling from your screening instrument, they'll endorse all kinds of forms of gambling. So on one side, the whole notion of being a gambler is stigmatized. On the other hand, people see gambling as just recreation and harmless, and it's mostly adults that are promoting this. So I think this starts with re-educating adults, teachers, coaches, parents, and we need to have sort of a two-pronged approach to this.
Obviously, we don't have any local lawmakers or otherwise on this Zoom call, so I just want to ask, when it comes to places like casinos, they bring in hotel tax, they create revenue for cities and states, online gambling, not necessarily doing that as directly. So what is the hurdle for local lawmakers to potentially create a bit more regulation around some of this online gambling? Timothy, can you talk about that?
Sure, there's lots of things about that. Number one, there's not a lot of advocacy groups. There's not a lot of mothers against gambling. There's not a lot of media attention. Still, when you talk to people in their mind's eye, what does a person with gambling disorder look like? They're going to have a stereotype view of an older white man smoking cigars, throwing craps, you know? So there's a ton of just not discussion. If I were a lawmaker and I were to bring forth a bill to address gambling problems in my community, that's not necessarily going to be politically very exciting. We can say in Congress right now, we have two acts. We have the GRIT Act and the SAFE Act that are looking at addressing gambling behavior. So that's the first time in a long time. But very simply, we've created a society where tastes are changing, where the demand for gambling is elevated, where popular culture is saying gambling and betting on sports is desired. And if you don't do it, you are actually missing out. So I go back to some very basic things. As an example, gambling advertising is supposed to fall under the letter of the law in terms of regulations. We have very tight regulations for advertising on guns, cannabis, smoking, and alcohol. But those laws are not being followed for gambling advertising, which again is an 18 and 21-year-old product. That's number one. And number two, if I had a prevention message for the young people, it starts not in junior high, it starts in grade school. When you're talking about that gambling and betting for money is not a reliable way of making money. So many of the young people I work with view gambling as their right. They view it as a successful path to making money. And they view what they see in the online world, rich men, bros, alpha guys, people talking about making spectacular success quickly, and they think that that will be what will happen to them. That drives demand. I know it's all around, a lot of topics that we're talking about, but again, capping advertising and following the letters of the laws, and really looking, what are we as adults saying to the young people what gambling is? Gambling is supposed to be entertainment. It's supposed to bring you closer together. It's not supposed to be an emotional salve. It's not supposed to be a get rich quick forever. It's not supposed to be a way for you to make generational wealth. And instead, when you turn on your social media, what do you see? Someone slapping on a parlay saying, I'm one leg away from winning $200,000. That's, I think, where we've erred as a popular culture message.
Victor, I want to stay with that for a second. This one is for you. Tim brought up a really good point. When you go to casinos, when you go to the horse races, you're betting in groups. You might be with friends, you might be with family, you might be with people who have similar interests as you. When it comes to online gambling, talk about how that can be a bit more isolating. And so no one's maybe seeing you develop an issue who might be able to step in and say, hey, let's get you some help. Can you talk about that?
Yeah, look, one of the things that we know about online gambling, and again, this is a phenomenon that is concerning, right? I think all of us have raised that. And so that is different than what we see in traditional forms of gambling. And what we're seeing because of the advancement in technology allows people to gain access in a way that never before, especially young people. But what we also understand about gambling in general is that people who engage in gambling at a more intense level, there might be undercurrent issues that are going on. So are people using or engaging in online gambling to really cope with their sort of depressive state, anxiety states, or whatever the case might be, or other states, right? Or other issues that they may be experiencing. Or in cases where we've heard from the community, are people engaging in online gambling because they're looking for opportunities to escape poverty? So I think that there's this phenomenon of engagement, of exposure to online gambling, and this and engagement really is concerning, because it's reaching a level that we have not seen before, especially with our young people. So I think there is still more to come for us to get a full understanding about its impact. But let's be clear, it is very concerning about what we're seeing currently.
We've seen this movie before, namely with cigarettes and alcohol. The growth of them was exponential. At one point, advertisers were telling people that cigarettes even had health benefits. And then eventually, we stamped a Surgeon General stamp on cigarettes. And eventually people started talking about how harmful alcohol can be. Are we going to start to see, if not already, the same trajectory with online gambling, a real push at a federal level and in society to promote the negative effects of online gambling, which we're really not seeing yet? Shekhar or Leah, either of you can take this.
Laura, I certainly hope so.
Hmm.
And I think there is a very good chance of doing that. Gambling, and especially online gambling, is relatively a recent phenomenon. It's about 10 years, maybe 15 years old. And alcohol and some of the drugs have been there with us for hundreds of thousands or even more years. So, and the research and the surveys and the full exploration of the harmful effects and the application of public health model is even more recent. We're talking about just a few years. So I think we need to develop the pressure. We need to develop the momentum. We need to present the evidence in a way that can be understood by the policymakers, but also by the society in general. And that's what's going to lead to increased momentum for that, increased need for those kind of regulations. But I would also like to point out that it's not just that the regulation and laws are made, it's how they're implemented. And I see it from a global experience that many countries have formed laws in the last 5 years, but their implementation is extremely poor because of either constraints on resources or because of other factors. And by its very nature, online gambling doesn't follow boundaries. You can have an online gambling casino in Hong Kong, which serves the whole of Asia. And a small country sitting somewhere there, does it have the capacity to stop that? And the answer is no. So we need local, national, but also international collaboration to form and then implement these regulations in the most strict manner possible.
I would add to that
Oh, yes. Sorry, Leah, go ahead.
That's okay. I would just add to that something that Tim had mentioned. We don't have advocacy groups, and unlike with substances, like with cigarettes, for example, one of the things that made the movement go is the health networks were identifying all these health effects of cigarettes because they were being tracked. The problem with gambling is no one is tracking gambling related health problems, gambling related suicides. This is not in the coroner's report. It's not. And so as a result, we don't really have the public health data like we had with alcohol, like we had with cigarettes. And this is compounded by the fact that there's a lot of shame attached to people who gamble away the house, et cetera. So families are not coming forward. And that's why there's not this level of advocacy. And these are the areas that are really holding us back.
Yeah, I think that's a really good point. Victor, how important is it that dealing with online gambling is a full court press? You're talking about treatment services, police officers, compliance, uh, academia, lawmakers, obviously, advertisers, casino owners. How important is it that everyone get on the same page in order to prevent some of these habits from getting worse and potentially, as Leah mentioned, saving lives?
Here by this panel that problem gambling is a public health issue and it requires public health strategies. And so it's critically important. But within that is using the tools of public health, right? Looking at epidemiology and data as a mechanism, as a compass that will guide us to mitigation, to really think about the social determinants of health, that the conditions that people are born, where they grow, where they live matters, that we know those are drivers of health outcomes and those where we see the largest levels of inequities. We need to think critical about equity. We know that people of color are disproportionately impacted by gambling. And so while we know this, we understand that there's a significant disconnection in both research and our work when it comes to communities of color. And so when we apply those tools across the continuum of care, what we're saying and what we're aspiring is that it needs to be comprehensive and it needs to be population based. And this is why public health matters. And so I am continue to encourage that our field continue to shift to a more public health sort of perspective in order for us to begin to unpack the concerns so that we can put strategies forward. But yes, in public health, collaboration is everything. That's how we work, right? And so all the parties that you name are essential in regards to working together in order for a common cause, which is to mitigate harm. And that is what we're striving to do in Massachusetts. That's what we're doing through the Office of Problem Gambling Services. And we're one of the few offices in the country that's doing that kind of work. And we're trailblazing a new path, and we hope that we can continue to inspire others to do the same. But again, it's a lot of work and there's a lot of concerns.
We have a few minutes left. I want to do a quick round robin here. Leah, we're going to start with you. If you, next time we do a panel like this, next time we talk about online gambling, if you could add one more person to this panel, who would it be? Would it be a casino owner? Would it be a senator? If you could pick one person to add to this panel next time, what would that person look like?
They would look like a senator who really sees the need for some kind of legislation to talk about the impediments, et cetera, to actually making this reality.
Shekhar?
I would get a person living with gambling problems. They can explain what they have undergone and can be a much better advocate than I can be.
Tim?
Get a high school senior to talk about kind of how this is impacting his or her life right now.
You know, my greatest joy at the Department of Public Health has been our work in community engagement. We've engaged over 2,000 residents in the Commonwealth who have led to our initiative. And so if I were to add someone to this panel, it would be community members that can come and speak to their perspective and how they see it. Because it's so valuable, so richly valuable when they are present and what they share, their perspective around this issue. And I will guarantee you it'll be quite interesting.
I want to thank everybody for being here to listen to these brilliant panelists. We are not going to end with my voice. We're going to end with these people who've been working on in this topic for as long as you guys have. You've been studying it. You've been advocating for it. So I want to do a quick round robin again, Leah, and I want all of you to mention a resource people can go to for help to understand more about this problem. And again, we're going to sign off right after. So if you're in the audience, thank you so much for being here. Leah, we'll start with you.
Well, our website is gambling.rutgers.edu, and I would also recommend the National Council on Problem Gambling.
Shekhar.
My recommendation will be for the researchers and scientists. Read the Lancet Public Health Commission on gambling published last year.
Tim?
So thankfully, we have a lot of really amazing digital solutions to this issue. You can take a look at our website, uclagamblingprogram.org, but there are also gambling recovery podcasts. There's also gambling apps out there to give people who are wondering about their gambling behavior. And there's online telehealth support there as well. There's also digital software gambling blockers. So all of these things are available right now, tonight, today, immediately. If you are wondering and want to learn more about your gambling behavior, or you need some solution you can put onto your phone today, they are available through a very simple internet search.
You know, I encourage everyone who's listening and watching to visit our website at the Massachusetts Department of Public Health's Office of Problem Gambling Services, and there you will find resources for both treatment and prevention and a whole host of other resources. So I encourage folks to visit our website, Massachusetts Department of Public Health's Office of Problem Gambling Services.
Thank you to our audience, our panelists, and the Harvard Chan School of Public Health. Have a great day, everybody.